It's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to recap a little bit more about the difference between different types of class 3 growth tendencies, especially in growing kids. We're going to talk about the difference between a mandibular excess case or a maxillary deficiency case. And how do you know which one it is? Well, obviously the gold standard is going to be to get a cephalometric x-ray like this, and then have it run into one of these various online programs. And if you don't know how to do this, I have a ton of content on my website, Straightsmile Solutions, specifically the YouTube channel. And you can go to the YouTube channel and put in the keyword CEPH, C-E-P-H, or you can just scroll down the homepage and there'll be a playlist all about CEPHs. But you can use one of these various companies, very low cost, that will spit out a report, standard deviations, things like that, norms, and it'll tell you which one it is. And sometimes it's both. It's a little bit of each. Doesn't mean you're always just one or the other. You can be anywhere on the gradient. So that is like the first step to know. Now, I'm pretty good at looking at a face that's class 3, and pretty much I can usually tell, but sometimes it's both. So it's always a good idea to have an idea. And remember, that's in terms of the diagnosis, but in terms of the treatment, a lot of this is going to depend on, there's so many factors that are going to come into it. You know, a mid-face deficiency or a maxillary deficiency is going to present a heck of a lot younger than a mandibular excess, which will likely get worse as the patient finishes their growth. On the tail end of growth, this will present on the early end of growth. So you're going to see this happening at, it could be as little as, 4, 5, 6, 7, 8, 9, and then it's usually about done. It's not going to get any worse. This might present a little bit early, but it'll get worse, on the tail end of puberty, at, 17, 18, 19, 20, 21 in boys, men, and at 12, 13, 14, 15, maybe 16 in girls. Big difference. And I have a lot of content on measuring growth and skeletal maturity and puberty and things like that you should definitely also check out. All of this content is also addressed in our Phase 1 course, which is available at Straightsmile Solutions. It's an on-demand digital course, very affordable, less than $500 for 13 CE units. And you will learn so much. But I also recommend that you start taking cases or being open to taking cases. You shouldn't be afraid of taking class 3 cases, especially if you're starting them under age 10. You should be afraid if you're taking them in older patients because it gets a lot harder and there's a lot less options. So definitely, I don't want you to not take these cases. I want you to take them, especially if you have a good patient who's willing to do what it takes. Now, it's not going to magically correct itself. You're going to have to do things that, maybe not at school, but when they're home in order to correct it. So if they don't seem open to wearing something at night or when they're home, that's going to correct it, then probably not a good patient for you to take. Both mom and patient needs to be like, yes, I will do that, and I want to see that enthusiasm. If they look like, nah, I'm not going to do it, then it's not worth anyone's, time. And they can go get jaw surgery later, or they can have a messed up bite later. That's later going to cause damage and wear down the teeth, and they're going to need full mouth rehab. It's going to be a heck of a lot more expensive to fix it when they're older, and a lot more uncomfortable, and the outcome's not going to be as great as if they fix it when they're young and just get it done with. So different types of options. Yeah, you can move lower teeth back. You can move upper teeth forward, but it's best to move the upper jaw forward. We, of course, want to do a full airway evaluation, perhaps an OMT evaluation. So much information, and it's pretty much all in our Phase 1 course. But just wanted to address this part. All right, thanks so much.